It's not Chris's dog.
Hi, everyone. My name is Julie Roth-Novak. I am the CEO and co-founder of PartySlate. I am really looking forward to having an expert panel discussion on how to produce safety-first events. And we're going to have a special spotlight on event testing and all of the implications, and also the big news from New York's governor about the ability to have events both inside and outside of 150 people with testing. I think that was perfect timing for this webinar. So I was excited for the industry, and I was excited for this panel that it came last week, this announcement. So first of all, I want to welcome we have so many new people today. I would love for you guys to give a little Zoom shout out in the chat room. You can change it to all panelists and attendees, and we would love to know where you are zooming in from. So I'm zooming in from a really snowy Chicago day. I'm very glad to be working from home with my step and repeat behind me, but please tell us where you are zooming in from. Canada, Boston, Palm Springs. Welcome, welcome, welcome. I'm gonna wait a couple minutes before we introduce everyone, because this was such a popular digital event. We had, I think, over close to 500 people that registered for today. So we have people from all over the country, and maybe some people in different countries coming in, who knows? This is a very hot topic, and I'm so pleased that since the beginning of the pandemic, we've been doing weekly digital events and bringing thought leadership, digital marketing, geekiness, which I love to do, and also trends and things that are happening in the industry. So today I have an incredible group of event industry leaders and a medical doctor with us to talk about safety first events. So I'm gonna let each person introduce themselves. We're gonna start with the one and only Steve Pastor. Steve, tell us a little bit about your background and also Event Doc, which is your new testing company that you brought to market in the recent months.
Well, thank you, Julie. I mean, my background is for 40 years. I've been in the event industry with my partner, Laura Lee. I co-founded Alpine Creative Group in the mid 80s. And we have now been, working in that field, even through, even through COVID. The genesis behind the Event Doc is that I was looking to assist the industry to help us move forward, to basically look at this not as my company, but as a co-op of people that are, leaders in the event industry as well as leaders in the medical profession, that we could design best practices that we could introduce to people so that they could understand what COVID is. I could not have done this project without the assistance of Dr. Chris Min, because I went to Chris when this first started. Chris is very modest, but I'll just mention that he's both an MD with a PhD in biochemistry. He understands the science of testing. And I didn't want to be like, Theranos, where like Elizabeth Holmes being walked through a courthouse, doing a test that, was non-existent. And I asked Chris if he could identify test protocols and specific tests that might work, because there are over 300 tests that have been approved for provisional use called emergency use by the FDA. And it was Chris's job to find out the ones that work, and he came up with 2. So, that's my background. That's the story.
Awesome. And Dr. Min, you want to give I know Steve bragged a little bit about your background, but tell us how you got into kind of this COVID safe events world and connected with Steve, and a little bit more about your background.
Yeah, so Steve has been a good friend for many years, and I've slowly come to learn a little bit about the event world, but I'm definitely a fish out of water here. But as Steve said, my day job is I'm a physician scientist. I work in biotech. I try to help develop new treatments for diseases like Parkinson's disease. I'm a board certified neurologist. But COVID was really kind of the most extraordinary medical challenge of our times. And I happen to be between jobs. I have a picture of Turks and Caicos in the background. I went on that trip on March 15th, 2020. March 10th was the last day of my previous job. Now I'm at a new biotech company, but I was literally sitting on the couch watching the world come to an end. And I decided, well, as a doctor, sitting on the couch 24 hours a day watching Netflix was not what I wanted to say I did during the medical challenge of our lifetime. So I actually volunteered and took care of COVID patients in the ER at Columbia Presbyterian in Washington Heights, and spent about 2 months full time working gratis and taking care of our COVID patients in New York City. And then Steve came to me and told me about his idea about the fact that the event industry, as understandably, possibly there's so many industries that have been hurt so badly, but the event industry in particular, your whole mission is to bring people together. And it's like in the time of COVID was completely decimated. And he said, well, we're going to come back at some point, but when we come back, we're going to have to figure out a way to reassure people that we were doing it in the safest possible way. And so I was perfectly happy to help him figure out the best possible way, given the tests that we have available to us.
That's great. Well, we thank you for your volunteer service and helping with the event doc, because I think companies like this will help increase confidence in people coming back to events. And we are so desperate to celebrate together again. So thank you so much for being here. Bob, let's hear a little bit of your background. Everyone probably knows you on this webinar, but tell a little bit about your background and how you got involved working with Steve and supporting this initiative.
So I'm with Ed, Libby and Company. It's coming up on 30 years almost in the business. Wow. We do event design and production. And so, yeah, we've been involved with a lot of the people on this call. And we've, been doing this a real long time. I guess, I don't know how long ago it was. It was somewhere towards the beginning of when this all started. Steve called me and told me about his idea, because we were all thinking about, if events start again, how will they proceed? What's going to make people comfortable? What's going to make the client comfortable? What's going to make the guests comfortable? And it all involved, testing to make sure, who was positive, who was okay to go. So Steve asked me to be a part of the advisory panel, and I, of course, said yes right away. And I think it's a really important move for us to make at this point if we want to see our events start and see people gather again. Absolutely.
And Guerdy, tell us a little bit about your background and how you got involved with this. I know you've been on another webinar with us, so you have so many topics you can talk about, but tell us a little bit about your thinking on getting involved and helping to produce safe events.
Thank you for having me. I'm an event planner and designer. I'm based out of Miami and New York as well. And I was brought into the equation, Steve, who I had called one day. I was doing a wedding in August. And I said, Steve, I need a bunch of masks for these guests. We want to make sure that they're celebrating safely and the whole thing. And so on that call, he said, well, speaking of COVID and all this, the masks that you need, here's an idea that I'm trying to pitch to other, industry leaders to see what they think about this. So I was very intrigued, and immediately he asked me if I could help, from a planner's perspective, to be part of the advisory board. And so I joined without a question. And so here we are today. And he's actually right next to me over there on the other side, 20 feet away from me.
Well, hopefully we'll get him. He's on mute now, which is good. I know you guys are in the same room, but we can still see his camera. There we go. Okay, we'll bring him back. But let's just get started. Dr. Min, I'd love to ask this question for you. The big news came out of New York, and Steve, maybe you can answer this as well, that it is now, in March 15th, I believe, or mid-March, people can gather 150 people or less. I think it's 50% capacity at venues, and there's some other regulations, but this was the first time we heard an announcement that said, from a government official, with testing. And I'm not sure if I'm the only one that didn't quite understand what the with testing means, but Dr. Min and or Steve, could you comment a little on what you think that means? And I'm sure there'll be more clarification as the date gets closer.
That's a great question. And, I think that one of the things I did appreciate about Cuomo, I'm also a violinist. And so another whole industry is the music industry that's just been decimated by this, and all my musician friends who have just been sitting on the sidelines. And he specifically called out, getting the arts and entertainment industry going again, the live arts and entertainment industry. And as you said, he also mentioned that he was proud of the Buffalo Bills and their playoff game, and they tested people. And I don't know the specifics of their regimen that they instituted for that game, but he commented on how they were able to have a playoff game with spectators, and it didn't turn into a super spreader event. And so he expressed confidence that with appropriate testing, that we can go forward and do these events in shared space without them all turning into super spreader events. What is lacking are the details. And so it's just speculation as to what I assume that once these events really start rolling forward, that they will provide some specifications. But at the moment, I think we're in the dark as to how they're going to stratify things. I mean, I can share ideas of how I would do them, but I don't know of anything that has come out from the Department of Health in the state of New York yet.
Okay, great. And Steve, did you want to comment on that as well?
No, I think that's Chris's area of expertise, so he encapsulated it properly. Thank you.
Yeah, so I thought I was the only one that was like, oh, interesting announcement, but not a lot of detail. But with everything with this pandemic, we're going through this for the first time, all of us together. So I think the fact that people are putting a spotlight, leadership positions on testing is really a very, very positive sign for everyone. So the combination of vaccines and testing will really ensure that guests and event professionals feel safer at larger, scale events. So I would love to ask, Guerdy, and then I'll talk to you, Bob. When you are planning an event and you want it to be safe, as we all do, Guerdy, what are some of the things you talk to your clients about in the early stages? I know I'm seeing more invitations with messaging about safety, and I see the bracelets when you get to an event, sharing your comfort level. In addition to testing, what are some of those things you can do in the planning stages to ensure guests and your teams feel comfortable?
Sure. Location. The first thing that you need to ensure is that the location is a proper place for you to host such events. If you, in Miami, for example, the rules are a little bit more lax than New York. And so here it's just a matter of having capacity of 50% of the room size. So if your guest count is 100, the room has to be a room that can actually fit more than 200 people for you to be able to have, proper social distancing, quota in place and so forth. So that's the first thing that I would say. And also then is the communication between yourself and your guests. So when you're communicating with your guests now, you have to ensure that via the RSVP, you're letting them know, for example, on-site COVID testing will be implemented, for example, so that they already have that, state of mind, and it will affect the RSVP percentage. So the more you communicate with them to let them know how safe you're hosting an event, the more likely someone will say, oh, okay, I'll attend this event because I know I'm going to be safe. And by the way, I just did my on-site COVID testing before I joined you guys, and that's why we're in the same room, and I'm negative, thank you. But the thing is that, even with the test results, you still want to make sure that you're show and telling. So you want to make sure that the waiters are still wearing masks, of course. You want to make sure that people are social distance when you're doing your seating to the best of your ability. So you still have to have the optics that you're doing your best to ensure multi-level layers of protection and safety for your guests. Other things that most everyone know at this point, obviously, definitely distribute masks, and offer them to your guests. Definitely have sanitizing, stations, signage for social distancing. One thing that I've done before COVID, but I do that for sure now more than ever, is for the escort card seating. I don't do cards anymore. I do a beautiful 16-foot wall with a font that's so big that you can just stand there 25 feet away and know where you're sitting, and you don't have to get close into a clutter with people. So anything that you can do to increase distance still and to try to promote safety with service of the food and washing hands, and the whole criteria is really the most important thing at this point, because we know there's variants now of the COVID, so we need to just be always on top of the disease, right? Yeah.
Absolutely. And when you talk about venues, obviously it's a big snowstorm in Chicago, so we don't have a lot of outdoor options, although tents at restaurants and greenhouses, there's a lot of creative options. But, what is your comfort level with indoor versus outdoor events?
Well, indoors is fine. Again, remember, I did an event, over the summer, but it was 100 people and the space could hold 600 people. So you're talking about real major social distancing. And we did also encourage them to dance at their table. So we already had the tables clustered into groupings of family members. So I'm like the same COVID germs in a sense. So everyone was already clustered in that sense. And so what we did, and actually it was an event, another event I did with, in New Jersey with Birch and Fred Marcus, is that we had under the charger plate, please dance at your table, stay and dance at your table. So when the chargers and the meals were done and they pulled the charger out, the first thing the guests see is notice, remember, dance around your table. So another reminder, and you can definitely have fun and celebrate safely, but you have to be take precautions. So indoor is fine. You definitely want to check to see if they have a HEPA, filtration system in their air conditioning, just to ensure that it's another layer of protection. But to be honest, COVID testing on site is really the safety, safety net.
So before we get into room configuration and design, let's talk a little bit about testing, which is kind of our main topic. We already have some questions in the chat room about. Let's start with you, Steve, and then Dr. Min. How does on-site testing work? I haven't been to an event yet where there's been on-site testing. I've only been to like outdoor backyard, small events. Mm-hmm. Tell us how it works, and then I'll show a quick picture of kind of what it can look like. Okay. Walk us through the process first, Steve, on how it works and how you should think about, is on-site testing right for your event? And there was already some questions about cost and things like that.
Okay, well, for anyone regarding cost, if they want to email me, and maybe you could share our email.
Yeah, we'll share your address in the follow-up.
Yeah. But we got together with specialists in in the event industry, such as Bob Conti, Michael Cirbelli, as well as people such as Chris, who are specialists in the, in the medical field, to put together a testing methodology that would work specifically for the event community. We developed this by event people, for event people. This is our own system. And I essentially look at this, as I said, as a co-op. When someone comes in, we have a front of house employee, essentially a coordinator that has everyone on a list that we have through an iPad. We have a proprietary system through DocuSign that they can sign up for specific testing times. We ask them, how many people are being tested, how long they want the testing for. Our average time period is 4 hours. And then after that, we then bring them to one of our stations where we either have a nurse or an MD that's doing the testing. We do not allow self-testing. We do not use employees that are not medical professionals. After the testing process is complete, they get a wristband that shows that they have tested negative. If in the unfortunate instance they've tested positive, they get a form of what to do. Also, when they're signing up for the system, we give them a liability form to read and to sign, showing that there is a possibility that a test could be misdiagnosed. It's rare, but it can happen. But it just, prevents issues for us. And if they forget to sign it online, we also have it there. We ask people to wear their masks, to require social distancing during that time, and that's basically the process.
And how long does it take to do, let's say, 100-person party? And what do you do with that? And let me actually share my screen, because I'm going to show. Recently in New York, you guys did an event. I think it was with Michael Cirbelli. Is that correct? And yes. And here's kind of a little view of what it looks like. Is that you, Bob, getting tested here? Yeah. And negative. Yeah, and walk us through a little bit about what this looked like and how the process worked.
Well, this is a smaller event. It was a demo event for our industry, but we can test with each individual nurse or MD up to almost 25 people an hour. So if needed, we could test 100 people an hour, just, with a staff of 4 people. We can extend it, make it 5 people, but 80 to 100 people per hour is really the max that we'd like to do. The other thing is, because this again is a medical test, we need to make sure that if there is unfortunately a positive test, we need to shut down the testing area. We need to sterilize it. It takes us 15-20 minutes before we start up again. So basically, you're looking at a small, sample size of how we would go about
And I
doing
did
that.
have someone ask me what we're looking at here. For people that are new to PartySlate, this is an event album that has all of the credits of the people involved in the event. And this is just showing a real event that was done with testing. And this is actually, we'll send you a link to this after. This is Steve's company, Alpine Creative Group. Event Doc is a different business that Steve runs, but we have an announcement here that links out to the Event Doc from this page. And again, there's a video on the Event Doc and then a sample event here as well. So thank you, Steve, for posting this, because I think some people haven't been to an event yet and don't know what to expect. And then Dr. Min, is there anything, I've had this concern, what if I do testing at my event and someone's really upset that they get a negative or a positive result, and they still want to go into the party? I don't know if that's happened, but I'm assuming you guys have talked about scenario planning for the upset guests.
I'll address that question, but I just want to make a couple comments first, because I know from my event planning partners that there was a lot of concern about, oh my God, if we have it positive, do we just have to shut the whole event down and tell the host just forget it and everybody go home? Because there's so much fear about what it means if someone who we test has a virus and is in the midst of us. And I would remind you that, as I said, I was working in a hospital where literally everyone was coughing up COVID everywhere. Not an environment at all equivalent to our testing environment, but just to lay the groundwork. So in the medical profession, the precautions that we use, the masks that we wear, the gloves that we wear are designed so that we as staff, my biggest concern about testing individuals in this setting is that the staff can get infected, not the guests, not the caterers, not anyone's, but meaning the testing staff. And so the precautions that we use are first designed to protect them because they're the most at risk, and then after that, one gets concerned about spread to, of course, to the others. And the fact is that if you use the appropriate, and this is why we only employ trained healthcare professionals to administer these tests, I'm a little bit shocked at how these tests are being conducted, whether it's by other testing companies or even at your local pharmacy, because of the issues of infectious control. We who work in the hospital setting are all trained and then practice for years how to conduct yourselves in a way that we are always employing infection control. And so, as Steve said, we recently did have it was actually a staffer, as it turned out, not a catering staff person, not a guest, who recently tested positive. And as Steve said, when a guest arrives, they come with a mask on. They check in with the check-in person that's working the event. That person also has a mask on. They briefly interact. There's never any physical interaction. You minimize those interactions. You make sure that they're the appropriate person, that they've signed the appropriate forms, and then they go to the testing area. All the testing personnel all have appropriate masks and gloves. And the only time that the person exposes themselves in terms of their nose is when they need to be tested. And just for the few seconds that you apply the swab, there's no physical contact between the tester and the person receiving their test. The only connection between the two people is through the swab. And then we process their results. And after their swab, they put their mask back on, and then they separate from the tester as well as other guests and maintain social distancing. So at the end of all that, when we had a positive test, just out of utmost precaution, we wiped down every surface that person might have touched with their clothing, with their hands, anything else. We just made sure that we wiped everything down with sanitary, with a disinfecting cloths, and made sure that there were no possible infectious surfaces, and then we proceeded. So I just want to emphasize that is.
It doesn't mean the event is shut down. It means that person is, asked in a nice way to go to leave, and that they were tested positive, and then the event. Yeah.
And then the advice that we give with regard to the test, there are potential for both false positive and false negative. So if the person, by definition, that amongst other things, that when they sign in, they attest to the fact that they aren't currently symptomatic, not having fevers, not having cough, not having other symptoms of COVID. Number two, that they're not, as far as they know, they have not been exposed to someone who actively is known to have COVID. So as far as that person, therefore, is defined as an asymptomatic case of COVID. Someone, as you may know, I don't know what percent, but there's a decent percent of COVID infections that can be completely asymptomatic. And there's a possibility that we're detecting a false positive. So we tell the person, I don't focus on like getting into the event, but I tell the guest or the staffer, you have a positive test. So for now, you are not allowed into the event for the safety of everyone involved. This test is not 100% foolproof. And if you were to get a PCR test, which is the gold standard test, and it were to come out negative, then I would consider this a false positive test. Mm-hmm. And so that's what they can do. And if there is some place available that can provide PCR testing, and in theory, there's no reason why a PCR test can't be turned around within a few hours. But the fact is, as you know, depending on how many people are getting tested and what the backup is and all that, generally speaking, you can't get it back that quickly. But the PCR test itself takes a few hours. So in theory, someone could test positive at the event, go somewhere, get a PCR test, get a negative result, and come back, later. Yeah. Perhaps towards the end of the event and say, I have a negative result. And I would, tell the host, I would consider our previous result a false positive given this PCR test negative.
And we do have a couple of questions, Bob. Maybe you can answer this on the setup of where the testing is. Is the testing outside? Is it under a tent? And maybe some other considerations for, as you're thinking through design and decor for the event, what are some safety considerations?
Sure. There's a whole lot to really break down about all of this. Most people on this call, we are all asking the same questions. We want to be able to do this. None of what Dr. Chris just talked about sounded like a party to me. About swabbing and this and that. And so it's two-sided. What we're trying to do is obviously mitigate, any problems. We want the host to be comfortable, and we want all the guests to be comfortable coming to a party. Yeah. So just because you get an invitation, and regards going back a little bit as to, the New York announcement, I don't know that we're going to get a whole lot of direction from them and specifics. I mean, we're how far into this, and we haven't so far. Yeah. Of course, people, our clients and people who want to have parties, they saw 150 and just say, okay, great, I can have a party for 150 now. Not necessarily the case, okay? Because if it is indoor, then you need to go, the local laws, and whether it's 25%, 50%. Mm-hmm. So there's all of that. So once you determine that you can have a specific amount of people that you invite, then you have to determine how you're going to test them. Now, because he didn't make it specific in his announcement, Governor Cuomo, you can do on-site testing. You can also accept a PCR test within a certain amount of hours. So you can give that option to your guests, and you can do this, on your invitation or, an email blast or whatever.
Website.
Yeah, so if you have 150, it's not necessarily that you're going to have to test 150 people, all in that town. So if they come with their PCR test within the hours and it's certified, then that's acceptable as well. As far as the testing, you were saying we could do like 50 people an hour or something like that. Then we have to make that sound, look, and work for the party. Yeah. So maybe you do an extended cocktail hour. Mm-hmm. Where people have a call time and they come, and of course, it's medically and it is all on site, but you have to make it look good, sound good. Maybe there's a little Latin guitarist, or maybe there's a little, and you make it feel like the luxury events that we're all here to produce. Okay, you need to make it feel, and so that nobody feels, unsafe, and that they feel like they're being welcomed to the event. And if you do those sorts of things and follow it through, then this can happen. But the important thing also to remember is we are not the police of all of this. A lot of us feel like, oh my God, it's my responsibility if, we're doing testing at the event. Then if somebody gets sick, then it's our fault and we're going to get sued and and it's not really like that. It's you provide all of the things, the best things that you can do to mitigate it. And then it's up to the people, the hosts, the venue, and everybody else to follow protocols to make sure it's a safe event.
Yeah, I think the corporations feel like there's potentially more liability than the social events, but I hear you, like, we can't be held accountable if we're doing safe events.
Somebody takes off their mask to dance or something like that, you have to stop them because it's not, and it's just, we all know already from doing some of these micro events, once they start drinking, then the party starts, it's, whether there's a mask or not a mask, but at least you have in the back of your mind, that everybody at this event has been tested negative.
Yes, absolutely.
And it gives you a little bit peace of mind.
And there is a bunch of questions on staggering events, multi-day. You guys are following along in the chat. You guys keep the questions coming. We'll try to get to all of them. And if we don't get to all of them, we're going to put together like a Q&A and we're going to answer all these for you and connect you with these professionals. But let's talk a little bit about multi-day events. I'm assuming you may not have had, Dr. Min, I don't know if you wanted to answer.
Sorry, if you don't mind, I just want to make one comment before we move forward.
Sure, go ahead.
Following on Bob's comments, and we talked about false positive, and then we also had the possibility of false negative. So we know, unfortunately, at the current time, there is no perfect test to detect. As I said before, if someone tests positive, they are an asymptomatic COVID, right? We're not, anyone who's sick, I think we would all agree, they should not be coming. And if we realize that they're sick and they're symptomatic, we'd be like, please, you really need to think about your fellow guests. And so then the question becomes, well, what about the false negative test? And the fact is that we don't even know what the negative test rate is, because the tests that have been authorized under this Emergency Use Act most of them have been certified to be accurate in people who are symptomatic and know they're sick and are just wondering, do I have the flu? Do I have COVID? Do I have something else? And so we don't know. And I specify, this is in our language of our document, as well as I tell every person I test, we do not know how well this test could detect COVID if you had an asymptomatic case. But this is the best test we have to offer. We're trying to make it as safe as possible.
Yes.
And therefore, even though I test you and I say you are negative, that doesn't mean, like, to God's truth, you do not have COVID. You could still be a cure of COVID, and you could spread the disease to other people. I don't emphasize that you're diseased. What I'd say is we don't know that this is a true negative. What we have is a test that's negative, and therefore we recommend that you continue to observe physical distancing and mask wearing as indicated to keep things as safe as possible. And that's what we do as an organization. And then the host and the guests, we know that in general, these events involve meals. So at minimum, you're going to be taking a mask off to eat and drink. And it's up to the host and the guests to kind of decide how they want to behave. Yes. But we make it clear that there is still a potential risk of COVID spread, because we can't exclude the possibility of COVID being in the event.
Thank you for sharing that. And then on to some of the questions about multi-day tests. Could you have a testing at a welcome session, and that kind of holds true for the 2-day event? Yes, Guerdy.
Yes. So when you have a multi-day event, there's a luxury of being able to actually schedule your testing prior to, and this could be done virtually. So what happens is that you'll work with the event doc, and they'll send. Did you mute? Mm-hmm. Thank you. Yeah. There's a lot of
Kylie, you can mute Steve too. Yep, go ahead.
There's a lot of opportunities for you to be able to schedule that. So if I'm coming, for example, for a 3-day welcome, wedding festivities, it starts Friday, Saturday, Sunday. So when I arrive to the hotel Friday, I check in, and then the hotel front desk, for example, will have my welcome bag with the welcome note, and then it will have where the testing will be taking place. So I've already made my virtual appointment, and I know that after check-in, I'll be able to go and fulfill that appointment, and so that can get tested on a flow, in a sense, versus having it all on site at an event. So we have to, I guess, separate a transient event, which is just one-time thing where you have 200 people in one place at a time, and now you do a pre-ceremony cocktail hour / testing, lounge, or you can do it where you're doing a welcome, wedding weekend, and people are able to come in whenever they want up until the day of the wedding, of course. So you're still going to have probably, some kind of testing pre-wedding for those guests who live locally. Okay.
Right. It's kind of funny, the new days of before you get your goodie bag, you got to go get your test, right? So then you get your welcome bag after
and in
your
the welcome bag, exactly. You got to now pick a favor, right? So now it's the mask and the sanitizers and all that stuff.
What a world we are living in. Crazy.
Yep.
And then Steve, there was a lot of questions about determining if you should have testing. Obviously, if there was no cost involved, I'm guessing most people would want to do testing, right? There's not much downside to it unless it's maybe a 15-person event or something. So how do you determine like what sort of budget you need? And I know each case is unique depending on how the testing and how many people you have, but how would you help people, event planners who are here, think about how to tell their clients about budgeting for testing?
Well, unfortunately, and I can share our pricing structure, testing is expensive. There's no way to get around it. We're bringing, 5 or 6 people to an event between our registered nurses, our doctor at times, a coordinator, as well as somebody, in the front just controlling traffic. Also, unfortunately, the companies we use, which are Abbott Labs and Becton Dickinson, do not discount their tests, no matter how many you order. If I order 30 or 30,000, it's the same price per unit. There's very few companies that, or industries that have that type of pricing structure. We're hoping that price points come down. I mean, our model is built for that. PCs at one time were $25,000. Now you could buy one for $500, something like that. But, short term, it's not inexpensive, but if someone wants to have an event, it's something that they should add to their budget.
Absolutely. And so just to give me a ballpark, if I'm having 150-person event and I want everyone tested, are we talking, $10,000, $20,000? Like, I'm just trying to think of like, what's a rough budget for that size event?
Got it.
And
so our basic price structure is up to 50. We charge a flat fee of $7,500, which is $150 per person. Anything over 50, we discount it to $120 per person. So if you were having an additional 100 people, that would be $12,000 plus the $7,500. So you're at $19,500. We give a 4-hour test window. A lot of people have asked us to extend the test window. Every hour that we extend it, before or after that, we charge an additional $500. We only charge for the number of tests that we do, up to 50, not the number that you think we're going to do. So if you say that we're going to need to test 80 people and we only test 60, you're only charged for 60.
Got it. And I know there's a lot of other testing companies out there that may not be following kind of the regulations. And I hear about like, people are self-testing and other things. Like, what are the regulations around testing that are out there?
Okay. So, Chris can answer that a little bit as well. But what we found that's disturbing is that this is a mobile test. It is a medical test. It's not a test that somebody who was a travel agent or a plumber or whatever just can buy a bunch of test kits and say, I'm a testing company. The way that the FDA had things set up is that and Chris was one of these, if you are running a lab, you need something called the CLIA certification, CLIA. And that is your lab certification authorized in different states to do testing. The FDA thought that the same good citizens like Chris Min would then be doing the mobile testing because it's still necessary to be oversight for your organization. Every single company that I've looked into, both in South Florida and New York, to my knowledge, is not following this protocol. There are a couple of doctors that are offering it or offering it through their nurses, but no rapid testing companies that have the ability that we do to go to an event, that have it coordinated, that the event planner doesn't even have to look at anything. They can just walk by and say hello and just leave. So that's
so this is custom built for special events, for events where you want it to run smoothly. It could be, there could be some real controversy around it. You get some negative results. You get, you want this to be done correctly. So
there's one more thing with that as well, Julie, which is that we are required, Chris is required to report to the State Board of Health if there's a positive. And then also, if necessary, we have the entire guest list to do contact tracing.
Yeah.
Somebody that's not a doctor, that doesn't have a medical background, isn't going to even know to do that or even know how to do that. So, you know, that's, you know, we're trying to protect our own industry, all of us that are listening on this call.
Absolutely. So I know there's been a bunch of questions. So if you guys on the panel see any questions that we didn't get to, you know, feel free to jump in with those questions. But Bob, going back to the actually event design and keeping your team safe, and what are some other considerations or new things that you've seen in addition to testing? You know, I think we've all seen the screens behind servers. I think buffets will be gone for quite some time. We won't see a lot of food buffets, but maybe individually wrapped or things. What are you seeing as far as the event safety itself during the event?
Well, there's a lot of different things. We could probably have a separate webinar about all the different things, and again, every place is different. Here in the in Europe, the country, those countries, it's like either yes or no. There's no in between. We have 50 different rules going on because state by state. So that's something to consider as well. I think especially in regards to testing, and when you talk about design, you have to remember that besides your 150 guests or your 100 guests and everything, you really should be testing all the staff, right? All the staff. So, and that's not only your waiters and waitresses and the people who, but all, the people that are going to deliver the party, all people that entertainment, the people who deliver the chairs, that afternoon, the people who are gonna pick up at the end of the night, all the linens and things like that. So everyone needs to be tested. And I noticed one of the questions was, who pays for this? And naturally, we would think, well, if the host wants to have on-site testing, the host then would be responsible for paying for it. There may be, this is all new to us, right? We're all just getting into this. We're all just learning about it for the first time. Perhaps venues, might be interested in sharing that cost. I don't know. I haven't, but I know that like in Mexico, I've already heard that there's a couple of resorts that brought in their own testing. They're going to test all of their guests.
I've heard of, my local hair salon is offering free testing. So like, I think businesses are starting to catch on to, I take this, and, someone has to pay, but they bury it in their costs, or they say it's a service. And I mean, obviously someone has to pay for it, but I do think I see more and more hotels jumping into that as well.
And in regards to the PCR testing, like, so if obviously, we're here to talk about on-site testing and that's what, but if the PCR test, in other words, if you say to guests, okay, go get your own test and then bring it to the event, and someone asked about, is that 72 hour the standard?
That gets into the biology of the virus. So theoretically, if you have a PCR test, you should be reasonably safe. If a negative test should carry you 72 hours, the reason for that is that it takes at least 3 to 4 days to become infectious. So like, assume that the moment that you got your PCR test, you got infected by a huge amount of virus. You're not infectious until about 72 to 96 hours at the minimum. So that's where that 72 hours comes from. So it would be not unreasonable for a host to say, if you've had a test that's less than 72 hours before from a PCR test, a reliable testing center, and it had a PCR test negative, then you don't need to have a rapid test on site. And to Bob's point, one other thing, there was another question about the staff and, if they're tested. Again, like we said about, I was saying before, there's a possibility of false negatives. So just like we do is done in the restaurant industry, all the staff should be wearing masks all throughout, given that they're not part of the guest list and not eating and drinking along with the guests, they should have a mask on at the entire time for the safety of everyone.
And there's also a union component to this discussion as well. So some hotels, for example, they may not want to test their staff via a third-party testing company. So I know that, there's been a couple negotiations that I was doing with some clients and venues where we are doing testing, and they are providing us some are providing us a room on site, but some are not, and saying you need to do it off site before they even come into the venue. So remember that, because when you're doing negotiations right now with all these pop-up events that are about to happen, especially with the new law in New York, that, try to ensure that you can try to get the actual staff of the venue tested too, because it would be a loophole if we get everybody else tested and the people are serving you are dropping droplets. So
Yes.
yeah.
And then also,
Julie,
okay.
the other thing is that the really big question to this, and I've seen it in the chat, and I know all our brides and grooms are asking, everybody just think, oh, if we do testing, then we can have our party without masks like we want. They just think it's the get out of jail free card. And, if we do this, then we could have that big blowout. And that's not necessarily the case. This is to mitigate and to give everybody a sense of well-being. What happens from that point? Obviously, people should still be wearing masks for the best. And, you can't say, but it's up to them. It's not up to us.
Right. It's up to them, the host, et cetera,
Yeah.
et cetera. Mm-hmm.
Absolutely. And there was a couple of comments and questions about the vaccine. And I know no one on this call has all the answers about vaccine. Vaccine will obviously, we already see cases dropping, which is great, but we know the vaccine will take quite some time to get out to everyone. And even with vaccine, there is, still that 5% chance, and there is some safety precautions that need to happen. Someone asked, and I don't know, Dr. Min, if you have a silver ball to answer this, but some restaurant workers are now getting vaccine on the list for vaccine. Do you think hospitality workers and other people will be kind of next in line after, obviously healthcare workers, essential workers, teachers?
I'd like to think that they should, given that
I think
that, yeah, but I'm no politician, so
yeah.
I'm not going to tell you. I mean, I thought that was a positive sign and a recognition of the fact that these people who are working in those environments are on the front lines and should be allowed. So I would just personally, I would support that, but I don't care to make a prediction about what our politicians.
But how do you think we should think about vaccine? So if, let's say I was a high risk and I got a vaccine, I'm going to a party with testing, could I show proof that I have a vaccine and not?
So as we're getting, that's a great question. So, technically speaking, the what we know from the vaccine trials in general for Moderna and for Pfizer is that if you receive the vaccine, you're protected from getting COVID. What we don't know is whether you're protected from spreading COVID to other people. And I'm not saying that that the vaccine will not also protect that, but it's just a missing piece of data at the moment. And in general, I've been explaining to my friends that it's easy to demonstrate the former, because if you're in my trial, I have your name, Julie, and you're and I know you got the vaccine, and I know that you should have gotten COVID, but you got protected. So you're protected by my vaccine. So I know that information. In order to know that your friends were protected from getting COVID, they're not in my trial. So how do I know that you were prevented from spreading to them? That's a secondary kind of information. One company did do something clever, which was they monitored all their patients and took nasal swabs of them all through the study. And what they showed was the people who were vaccinated had negative nasal swabs. So therefore, those people were protected from spreading COVID. And so that's the first vaccine trial where they showed that their vaccine prevented spread. But I expect that as time goes on, we'll fill in that gap of information, and that not only does the vaccine protect you from getting COVID, but it protects you from spreading COVID.
That's what we hope.
So right now,
we hope.
So right now, we took a conservative stance. Our recommendation to the host is that we, and the other thing about the vaccine is, if you got your vaccine yesterday, first of all, as you know, the two approved, well, they're not approved. They're just like our tests.
Yes.
Emergency use act. So they're not fully approved. But in any case, the two vaccines that are currently allowed in the US, one from Pfizer and one from Moderna, are both 2-dose vaccines.
Yes.
So just because you got a shot of the vaccine doesn't mean you're protected. You need 2 shots. And not only do you need 2 shots, but your immune system needs about 3 weeks to respond to the vaccine. So it's really 3 weeks post second shot that you're fully protected.
Yeah.
So I think we will get to a point someday where someone comes in and says, here's my thing. I got my second shot of my vaccine a month ago or 2 months ago or whatever it is. And then we'll say, fine,
Yeah. So I think the answer is that if you have the vaccine, you have the 3 or 4 weeks after the second shot, and you have proof of that, you may not need to get tested, but we know it's going to be quite some time before they work through the pecking order of all the people that need to be vaccinated. So this could be, through the summer. I mean, the sooner the better. And then even after that, to be hyper cautious, because there's going to be some people that are not going to get the vaccine, which we won't go into, but that could also be a reason to have testing if there's people that are not choosing for whatever reason not to get vaccinated.
Well, what I anticipate is that if we get to what's called herd immunity, I don't want to get too deep in the weeds of the science, but if we get to 80% vaccination across the board, then we're not going to be talking about COVID at all. It's going to be like 1999 party all the time. But before we get
I'm ready for that, guys. I'm ready. And I want to say to all the people that are calling in today, and I know I say this every time, we feel for all the businesses that have been impacted.
Absolutely.
And we respect everyone who's innovating. And again, Steve, stepping up in so many ways to make events safe, because I think one thing we've learned from this pandemic is we want to be together and we miss being together. And so I just want to shout out to everyone how much we respect and feel for this industry that's been hurt, and thank the people that are helping us to get back to safe events. We're going to make it, guys. So we have only, believe it or not, 8 more minutes. I feel like we've only been talking for 10 minutes, but this has been so interesting and we have so many questions that we didn't get to. So anyone on the panel that wants to pick up any of the other questions that we haven't gotten to yet, I'd also like to leave time for kind of some lessons learned, silver linings, things that you've picked up in hosting safe events and trying to get back to safe events that you can share as words of advice for the people that are listening in. Maybe I'll start with you, Steve. Is there any final thoughts or any questions that you would like to pick up from the chat? Oh, I think you're still on mute, Steve. Steve's on his iPhone, so it's a little harder. There you go.
Sorry. Okay. Can you hear me now?
Yes.
Yeah.
Yes.
Okay, good. So first of all, anyone that is missing cost estimates, like I just saw across the screen, Julia will provide information.
We're going to provide the link and email.
Yeah.
Yes.
One of the things that I'd like to emphasize is that whether you use the event doc or someone else, it's important to ask the right questions, such as, do you have an MD supervising your testing? If so, does that MD have a lab certification? Ask for the lab certification to be sent to you for proof, because there's so many people out there that are just scamming us. So we want to make sure that whoever we are using is safe and is following the right protocols, because even without having the lab certification, it leads to abuses. There's a company in Florida that's taking tests at an event, and then they're bringing them to their own location for analysis. By the time they do, according to our medical experts, it's invalidated the samples. Things like, if you're using anyone, whether it's the event doc or someone else, make sure that they have that information. Make sure that they also have the ability to be insured at a venue, because these are not event people. They don't even know that they need insurance. They're going to say, what do I need that for? So just be very, very careful. That's and also ask them, what test are you using?
Yes.
So that's what I would impart.
That's important. Bob, any advice from you on how people should think about this and lessons learned?
I think there's a lot of talk and a lot of questions about the cost, and depending on what market you're in and where you are, if you say $10,000 or even $7,500, or if you have say $20,000, that's like that can be a deal breaker, you know, for a budget for some brides. We're, you know, all in the top of our markets, and we've been doing this a long time. Part of what we do, and part of the reason why you would hire someone like Guerdy or someone like me, is because we're going to point you in the right direction as to how your money is spent. And this can be, if you want to have the party that you want to have, and you have the resources, so you can move resources around. It depends on how important it is to you, to your guests.
Yeah.
And the other thing is maybe partner, because every venue is going to be different, right? There's hotels, as Guerdy mentioned, with unions. There's golf clubs that have boards. There's someone was asking about outdoor, you know, does this apply to outdoor parties, or do all the rules? And the rules change, and there's no way for everybody to keep on top of it. So you really do need your planner, your designer, your, you know, your venue person. Everybody needs to be on the team and work this through together.
Absolutely. It's again, we joke about saying the word unprecedented, but it is an unprecedented time for this industry. And so I think we all do have to get educated, and to the best of our knowledge, if we don't have the information, to tap an expert who is on top of it. We only have a couple more minutes. Dr. Min, I want to ask any parting thoughts or lessons learned through these initial events that you've been doing testing at, or anything you want to share. I know you've been answering some questions.
Well, I have to say, you know, I've been encouraged by our experience. You know, I was really dreading having to tell person after person, Matt, you can't come in, you're positive. Yeah. And the fact is that our guests have largely been COVID negative. And I think that people have, you know, behaved themselves. They know they're going to an event. They know that the host has taken the time to tell people they're having a safe event, that they're going to get tested for COVID on site. And I think that in general, that the groups of people, including very young people going to a wedding in Florida, have been behaving themselves. I think that, you know, especially given the prevalence of COVID right now in the counties that we've been testing in, the fact that everyone has largely been negative, we have, you know, the good thing is, in another way, a good thing is that we have detected positive. So that means that we're not just mixing water and just saying you're good to go. We actually do detect it when it's there. So I think that people are willing to behave themselves in order for that opportunity to gather together, as you said. I think people really want to spend time together. Yes. And they're willing to take the trouble to, you know, try to do what they can to make it safe.
Absolutely. Guerdy, any final thoughts or lessons learned?
I definitely think and feel the same way as Bob. And it's a priceless moment that you're trying to put together. So I know that sometimes funds could be a little tight, but really it's a protective measure. So it's really something to consider. Yeah.
Absolutely. Well, I appreciate you guys so much. And again, I feel for the industry. For those of you who don't know, you know, PartySlate, we are a platform where you can share your work and build your brand, but we also feel obligated, and we want to help the industry rebuild. So a lot of what I've been doing is my digital marketing kind of geeky sessions that many of you guys have joined, but sessions like this, I feel so good to provide this information. I had many of these questions, and I'm in the middle of the industry, and so I'm assuming other people did too. So I really, really appreciate your time. And Steve, I'm so impressed with the new company that you've built overnight. And I do think it's a great service to this industry. So thank you for your leadership.
Well, thank you, but it was collaborative. It's a collaborative effort.
He doesn't like any credit, Steve. So
Thank you.
Yeah. You brought together the best.
Okay.
And
you did.
You are such a connector, and I appreciate all that you guys have done. And thank you to our panel, Dr. Min, Bob. Okay. We love hearing from you. Anything you say with, yes, Bob's got a good idea. And Guerdy, so thank you guys for the information. We will follow up with a recording. If your colleagues couldn't listen in, we will also do kind of a little recap of this. And then tomorrow, I'm very excited. We're doing our first Clubhouse. Who likes Clubhouse? Anyone? Okay, so Steve, don't worry. We'll tell you all about it later. We're going to be talking about Instagram, a much lighter topic. We like to balance it out on Clubhouse tomorrow. We'll send you a recap email. Thank you again so much, and have a great day. And everyone stay safe.